There are basic CPR skills used to provide the most effective approach to cardiac arrest. These include high-quality chest compressions, high-quality rescue breaths using a CPR mask or bag mask device, use of an automated external defibrillator, and checking for life-threatening emergencies using a BLS assessment. External compression of the chest increases pressure inside the chest and directly compresses the heart, forcing blood to move from the chest to the lungs, heart, brain, and the rest of the body. To perform proper compressions, the person needs to be positioned on his or her back on a flat, firm surface. Kneel close to the side of the person. Place the heel of one hand on the center of the chest on the lower half of the breastbone. Place the heel of your other hand on top of and parallel to the first. Bring your body up and over the chest so your shoulders are directly above your hands. Bending at the waist, use your upper body weight to push straight down to a depth of at least 2 inches. Lift your weight and allow the chest to fully return to its normal position. Move immediately into the downstroke of the next compression. Focus on high-quality techniques. Compress deeply more than 2 inches. It is likely you will not compress deep enough. While injury could occur from deeper compressions, do not let the fear of this affect compression depth. Compress fast, between 100 and 120 times per minute. Do not let a higher compression speed result in a shallower compression depth. Do not lean on the chest between compressions. Blood pressure is created and maintained with ongoing compressions. When compressions stop, pressure is quickly lost and has to be slowly built up again. Allow the chest wall to fully recoil or rebound at the top of each compression. Minimize interruptions when doing compressions. When compressing properly, you may hear and feel changes in the chest wall. This is normal. Forceful external chest compressions may cause chest injury, but are critical if the person is to survive. Reassess your hand positioning and continue compressions. As an alternative approach, you can grasp the wrist of one hand with the other when it is difficult to compress with the heels of both hands. To perform chest compressions on a child, position the child face up on a flat, firm surface. Place the heel of one hand on the lower half of the breastbone, just above the point where the ribs meet. Using upper body weight, compress at least 1/3 the depth of the chest, or about 2 inches. Lift your weight and allow the chest to return to its normal position. Without pausing, continue into the downstroke of the next compression. Continue compressing at a rate of 100 to 120 compressions per minute. Remember to compress fast and deep and allow the chest to recoil to its normal position at the top of each compression. Compressions on a larger child can be tiring. If needed, use 2 hands to perform compressions. To perform chest compressions on an infant, position the infant face up on a flat, firm surface. Place 2 fingertips on the breastbone just below the nipple line. Compress at least 1/3 the depth of the infant's chest, or about 1 1/2 inches. Allow the chest to return to its normal position. Without pausing, continue into the downstroke of the next compression. Continue compressing at a rate of 100 to 120 compressions per minute. Remember to compress fast and deep and allow the chest to recoil to its normal position at the top of each compression. When doing chest compressions with 2 or more providers, encircle the sides of the chest with your hands and use your thumb tips to compress the lower third of the breastbone.